Chairman, thank you, and Senator Durbin for the hearing today, and thanks to our panelists for being with us. I want to start with General West. General West, you did me a favor, although I hope you think I did you a favor, but thank you for presenting the meritorious unit commendation to the women of the 688th here in Washington, D.C. last week.
Thank you, sir. It was my honor to do it, and yes, sir, you did do me a favor.
I really wasn't fishing,
awesome.
but I know I met with these women soldiers at Fort Leavenworth. It was a great experience for me, and I just know it was for you as well.
Yes, sir.
So thank you, and I know your presence there would be very meaningful to them. This is a group of African-American women who in World War II delivered the mail in Europe in a segregated way and honored their country and did their job so well. It was a great moment to meet these women, and I appreciate your presence.
Well, thank you, sir.
And a couple of issues for all of you. I guess one of them for all of you. I'm working with a number of my colleagues, but have an interest in the issue of toxic exposure. I'd like to know that each of you would support our efforts to get the DOD and the VA on a similar page and working together as we do a couple of things. First of all, research. We've introduced legislation that became law. One of the things we're paying attention to is intergenerational consequences of exposure to toxic substances. The scientific community has, in a study that was required, it's a study outside of the VA, has indicated that there is a need for additional research into this topic. And that, of course, that research will require information. We've worked to get DOD to make records, location and exposure circumstances available to certainly to veterans and to retired military. But it would be useful to me to hear from each of you that you are understanding of this issue and willing to devote your staff's time with the Department of Veterans Affairs toward response to toxic exposure from Vietnam to Iraq and Afghanistan. General West and Admiral.
Yes, sir, absolutely. The U.S. Army Medical Command's the Public Health Center really devotes a large amount of their time to that toxic exposure, burn pits, for example, registries to determine whether or not our service members and even family members as well are exposed to any toxic agents, not only where they work, where they're deployed, but also where they live. We've been asked to check air samples. We have our industrial hygiene team members under the Public Health Center that goes out. They do epicons where they actually go to see if there's any epidemiological case by case, if requested, to look to see if there are any issues in an individual's environment. And then on a strategic level, again, those registries that identify locations and trying to triangulate locations with symptoms and then any type of research that might assist us in determining any countermeasures or mitigating strategies if individuals are going to be in that environment.
Thank you for those details. I'm interested in making certain that the Department of Defense sees this as an issue both for DOD and for the VA. That true, Admiral and General?
Yes, sir, absolutely. As I shared in my opening statement, we view care of our service members and their families as a sacred trust that's placed in our hands. And part of that is making sure that we understand the environments in which they go and serve, and that we understand the health consequences of that. As General West said, we have public health commands, all of us, that are very actively engaged in research, in epidemiological surveys and studies to understand the potential impacts of toxins and other environmental factors on the health and wellness of our service members or families, not only during service, but after service, as you know, since many of these don't manifest for quite some time.
True.
So absolutely engaged in those partnerships.
Thank you.
Yes, sir. The Air Force Medical Service is also actively engaged and understands the need to not only research exposure and what that does to our airmen and our families and the community, and having registries available so that it can be tracked. As Admiral Faison said, many of these things don't manifest themselves till later down.
Thank you very much. The National Academy of Sciences did the most recent study, and they are suggesting, encouraging that that DOD start monitoring exposure so that we can prevent the exposure, obviously, from occurring in the future. The second issue I want to raise, this one perhaps to you, General West, is suicide prevention and mental health issues. Senator Tester, who just joined us, he and I have introduced legislation related to these two issues, to suicide prevention and mental health issues. It is, again, a request that the Department of Defense and the services commit to working with the Department of Veterans Affairs so that we can coordinate. Much of what we seem to know today is that there has to be a continuum of care, treatment, and attention, love, compassion for those who are departing our military and becoming veterans, and that the space in that time is one of the most important as we find opportunities for our servicemen and women to pursue careers outside the military. And so, again, I would highlight the importance of DOD and VA cooperating. General West, you were of extreme help to me, and I'm extremely proud of what I see at Fort Riley today, Fort Riley, Kansas, in regard to Irwin Army Hospital, and I thank you for your help in that regard. Just next door to that new hospital, though, is one of the few remaining warrior transition units, and I would expect you to be familiar with the National Intrepid Center for Excellences, NICO. I'd like to see the opportunity for a NICO to exist at Fort Riley, in part because of the warrior transition, the new Army hospital, and 25,000 veterans that surround Fort Riley. And I would ask you to help me understand the process by which the Army works with the foundation to make determinations. There's 8 sites across the country. We'd like to see, to learn why we can't be on a short list of a place that for a next facility. And I would appreciate your willingness to work with me to understand how you, the Army, and I can be of help in making that case to the foundation.
Yes, sir. I appreciate the opportunity to answer that. As our wounded warrior population has thankfully decreased from a high of over 20,000 when we had 45 warrior transition units across the Army, down to the current 14 that we have Army-wide, for about a population of about 2,000. Where we have our assets located throughout our installations is determined again by the population density for those areas. And I know, working with the foundation, not only with the Army, but they work with the other services, because they also try to pick if there's a location, if there's joint, if there are other services that can benefit from that. But I will, sir, get with you on with the Intrepid Foundation to get
That's a good point. Not every veteran of those 25,000 are Army veterans that
Yes,
surround Fort Riley. Admiral Bono, just to conclude, I would ask your help in our Veterans Committee. It seems to be a theme in my conversations today. But we're having a hearing next week in regard to access standards for the new John McCain Mission Act.
Yes, sir.
And part of what the efforts that went into that legislation were to study, to inform ourselves about DOD and how they allow military retirees to access health care. And so the access standards in that legislation are based upon what I think is pretty sound science. And I would welcome your input to the Department of Veterans Affairs. I hope that you would be asked to testify. And if I can get you to assist me in informing my colleagues about this topic, I would welcome that.
Sir, I'd be very happy and delighted to do so, and I'm very much in support of what you're trying to do.
Thank you. And I'll submit for the record a request for information from you, Admiral, about physical therapist regulations and the time frame we're on in getting those completed.
Yes, sir.
Thank you, ma'am.
Thank you.
Thank you, Chairman.
Senator Tester.